It's Patrick Hutzel from intensivcarehotline.com with another quick tip for families in intensive care. So one thing that you hear me saying over and over and over again is that the biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. Case in point today. So we are currently working with a client who first came to us and said, look, my dad's been in ICU for 50 days. Then he went to LTAC and he can't come off the ventilator. That's at least what they're telling me. And now they want to send him to a skilled nursing facility. So here is what we found. So we've got access to the medical records. The client also sent us some pictures of the dad. And it turns out he is not ventilated. He's got a tracheostomy, but he's not ventilated. He's on a T-piece. Now, a T-piece looks similar to a ventilation circuit, but a T-piece for a tracheostomy client is just attached usually to a humidifier to either deliver humidified air or humidified oxygen. But that's not a ventilator. It's just to moisten the air that a patient is breathing in and out. That's all it is. So, intensive care and anything related to it, like whether it's ventilation, tracheostomy, medications given, nursing care, it is such a highly specialized field that you can't really hold it against anyone that they don't know what they don't know. But, there's a major difference to, if someone is ventilated or not, because if they're not ventilated, they're not on life support. They have a life-saving device, which is the tracheostomy, but it's not considered life support as such. So that is my quick tip for today. Now, because we get so many questions for families of critically ill patients in intensive care, that's one of the reasons why we created a membership for families of critically ill patients in intensive care here at intensivcarehotline.com. And you can get access to the membership. And you can sign up to become a member when you go to intensivcarehotline.com and you click on the membership link, or you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email. And we answer all questions intensive care related. And in the membership, you also have exclusive access to 21 videos and 21 ebooks that are specifically written and recorded for families of critically ill patients in intensive care, making sure they can make informed decisions, have peace of mind, control, power, and influence. I have worked in critical care for nearly 25 years in 3 different countries, where I also worked as a nurse unit manager for over 5 years. And I've been consulting and advocating for families in intensive care all around the world since 2013. And I can say without the slightest hint of exaggeration that we have saved lives with our consulting and advocacy. And you can verify that at our testimonial section or at our podcast and video section, where we have some client interviews, Therefore, I also offer one-on-one consulting and advocacy for families in intensive care over the phone, Skype, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. And I talk to doctors and nurses directly, making sure that you make informed decisions, have peace of mind, control, power, and influence. And I also make sure that the doctors know you have someone on your team who understands intensive care inside out just as much as they do. And it'll change the dynamics in your favor. Once again, have a look at our testimonial section and at our podcast section. I also represent you in family meetings with intensive care teams. So once again, that your loved one gets best care and treatment, but also to make sure you have a strategy when you go into family meetings with intensive care teams. 99.9% of families in intensive care have no strategy whatsoever. And that's why they're fighting an uphill battle. Also, we offer medical record reviews in real time so that you can get a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website or send us an email to support@intensivecarehotline.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families of critically ill patients in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.